Hello and welcome to Med4 Care. I am Dr. Care and today's topic will be bruxism. Let's find out together what it is. By bruxism we mean the habit of involuntarily clenching and grinding the teeth in a rhythmic and spasmodic way. It is therefore a non-finalized muscular movement, also called parafunctional. Sometimes annoying and noisy, not so much for those who perform it, since they are not aware of it, but for those who hear it. The bruxism is a more frequent problem than one might imagine. The real distribution in the population is variable, because it depends on the diagnostic criteria. However, it is estimated that nocturnal bruxism has a prevalence between 1 and 15%, while awake bruxism is between 22 and 30%. A meta-analysis study noted that there is an association between hyperactivity syndrome, ADHD, and bruxism. The study found a greater association among children with ADHD syndrome, 3 times higher than other children. We can divide bruxism into primary and secondary. Primary bruxism is unrelated to other health problems. It is a multifactorial problem. Some risk factors are stress, anxiety, smoking, alcohol, and caffeine abuse, or dental malocclusion or misalignment of the dental arches. Secondary bruxism is related to neurological disorders or a side effect of some drugs, neuroleptics. The main symptom reported by people with bruxism is involuntary grinding of teeth, especially during sleep. Often the symptom is reported not so much by the subject, who often does not realize it while sleeping, but rather by the people with whom he sleeps, because they can testify to the noise of teeth rubbing against each other. Sometimes other symptoms are related, such as headache and ear pain. The physical examination looks for signs of wear on the teeth. The doctor can often notice the thinning, especially of the upper incisors, which can become very thin, especially at the extremities due to the continuous rubbing against the lower ones. Teeth can also be chipped and experience increased sensitivity due to the loss of the enamel layer that comes off due to rubbing. Among the imaging methods, it is important to perform an orthopanoramic radiography, which allows to highlight alignment problems of the dental arches, malocclusion. Among the functional tests, polysomnography is the gold standard exam for a certain diagnosis of bruxism. Polysomnography also allows you to check sleep cycles and consequently the effectiveness of night rest. The consequences of this disorder affect both the teeth and the body in general. At the dental level, we have already talked about how chipping or cracking of the teeth is the main consequence. It is even possible to break the tooth, creating imperfections. The incisors, those in the center of the mouth, are in fact the most affected. As for the organism as a whole, people with bruxism often complain of disorders beyond the dental problem. The chewing muscles are, in fact, in a condition of continuous stress, without relaxation or rest. This produces a feeling of fatigue, soreness, or pain in the jaw and dental arches. In addition, fatigue of the chewing muscles often leads to fatigue of the neck muscles as well, resulting in stiffening and inflammation. In the long run, this can also cause muscle tension headache due to constant inflammation of the neck muscles. The best way to prevent teeth from being damaged is to reduce the extent of bruxism. For this reason, stress can be reduced by using relaxation techniques. Another method to reduce the phenomenon of bruxism is to avoid all the behaviors that tend to favor it, so avoid drinking alcohol and coffee and tea, especially after dinner. A third method is to put a mouthguard, or bite, at night in order to avoid rubbing of the teeth. The bite stands between the dental arches, which therefore do not risk injury. As for the wear of the teeth, although bites are considered effective in reducing the phenomenon, there is still no definitive evidence that can totally eliminate it. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med 4 Care.